The liver is the second largest organ after the skin in the human body and is the largest gland, weighing around 1.5 kg. The liver is triangular in shape, with its base to the right and its apex towards the left. The liver occupies the right hypochondrium, part of the left epigastric region, and part of the left hypochondrium. The liver is covered by the diaphragm, and the diaphragm in turn is covered by the ribs and the costal arches. So these are the costal arches. The liver is below the diaphragm. As I said, that it is covered by the diaphragm, and liver is attached or anchored to this diaphragm by ligaments of the liver. And the common ligaments of the liver are right coronary ligament, left coronary ligament, that continue as right and left triangular ligaments, and it is also supported and attached by the falciparum ligament to the posterior wall of the anterior abdomen. And this diaphragm also separates the liver from the lungs and the heart. The liver is pinkish brown in color. It is highly vascular and friable and is soft in consistency. The liver is covered by the ribs, and the length of the liver or the liver spine in mid-clavicular line is 8 to 12 centimeters, and the length of the liver just below the xiphoid process is between 4 to 8 centimeters in mid-sternal line, and the transverse diameter of the liver is around 23 centimeters, and the thickness of liver or anterior posterior diameter of liver is around 12 centimeters. As I said, normally in an adult the liver is not palpable, but sometimes may be palpable only 2 to 3 centimeters below the xiphoid process, as the rest is covered by the costal arch. Liver can actually move in a range of 2 to 3 centimeters downwards when the person is standing or inhaling, and can move also upwards when he or she is lying down or exhaling. The liver is covered by the connective tissue which is called as Gilson's capsule, and this is quite adherent to the liver, and this Gilson's capsule also ensheaths the hepatic vessels, bile ducts, as well as the portal vessels. And this Gilson's capsule, which is closely adherent to the liver, also sends trabeculae within the liver or inside the liver, and these trabeculae form the septa of liver lobules, as the liver lobules are building blocks of the liver. So you can see here, this is the Gilson's capsule, small and thin sheet of connective tissue, and over which the peritoneum also gets connected, or over which the peritoneum can form the folds, and they can form as ligaments over the superior surface, anterior surface and posterior surface of the liver. Now let us come to the surfaces of liver. The liver has 5 surfaces as is shown here. Let me show it on myself how the surfaces of the liver are being described. Now there are 5 surfaces of liver. This is the anterior surface of the liver, and this anterior surface of the liver, is covered by diaphragm. If I move like this, then what the surface you are seeing here, this is the right lateral surface, and this border you can see from here, from the apex at the left hypochondric region, this border, this is called the inferior border of the liver, and this border is very sharp, and this border separates the anterior surface from the visceral surface. Now, as I said that this is the anterior surface of the liver, and this is the right lateral surface of the liver. There is one more surface of the liver here, which is called superior surface. All the 3 surfaces are continuous. There is no demarcation, and this continuous surface which you see here constitutes the diaphragmatic surface, because as I said, it is covered by the diaphragm, and it consists of the anterior surface, right lateral surface and the superior surface. Now if you see here, this one is the inferior surface. So as I said that this inferior border separates the anterior surface from the inferior surface, which is also called as visceral surface. Now the other surface is called as posterior surface. Now if you look here, this part is the posterior surface of the liver, this part. And if I go a little bit like this, and this is the inferior surface of the liver. So this is the inferior surface of the liver, and this is the posterior surface of the liver. Now if I put like this, if I place it like this, then this is the superior surface, this is the anterior surface, this is the right lateral surface, this is the inferior surface, what you see here, and as I said that this is the posterior surface. This is the diaphragmatic surface of the liver, and this diaphragmatic surface of the liver is separated from the inferior surface by the inferior border. This is the inferior border, and this is the inferior surface. The inferior surface is also called as visceral surface, because this inferior surface is directed to viscera of the abdomen. So if it is like this, so here will be the stomach is coming here, so here will be the stomach, here will be the duodenum, this is the gallbladder,
then here will be the right flexure of transverse column, then right kidney and right suprarenal gland. So this will be the relationship of inferior surface with the viscera. Now if I tilt it like this and show you the visceral surface, then this visceral surface, you can see there are two vertical fissures. So this is the one vertical fissure, and then there is a one imaginary vertical fissure like this, and this part horizontal is the porta hepatis. So it forms here capital H shaped structure. So this vertical fissure which you see here, this is the fissure for ligamentum teres. So you can see here, this is the ligamentum teres, and on the left side of the caudate lobe, there is this fissure is here. This fissure lodges the ligamentum venosum. So this is the ligamentum venosum which you see here. The other structure, the other structures in the inferior surface are, this is the caudate lobe, this is the quadrate lobe, this is inferior vena cava, and this is gallbladder. So anatomically the inferior surface is divided here along the ligamentum teres and ligamentum venosum, which divides the liver into left lobe and right lobe, so that the caudate lobe and quadrate lobe is included in the right lobe. But this is an anatomical division. The physiologically or functionally, the liver is divided by an imaginary line like this. So this imaginary line crosses from the gallbladder and the inferior vena cava. So physiologically the liver will be divided here. So this portion will form the right lobe, and this whole portion will form as the left lobe. So functionally the caudate lobe and quadrate lobe will be included in the left lobe. The impressions on the inferior surface are, starting from the left lobe is the gastric impression, and this quadrate lobe has got an impression for the pylorus or the duodenum, and this is the gallbladder, and this is the impression for right hepatic flexure of the transverse column. This impression is for the right kidney, and this impression is for the right suprarenal gland. So that was about the inferior surface of the liver. This is the falciparum ligament. The falciparum ligament divides the liver into two lobes, the left lobe and the right lobe. Then falciparum ligament is continuous with the another two ligaments. One is left coronary ligament and right coronary ligament. The right coronary ligament has got two rims. The left coronary ligament also has got two rims. So this is the anterior rim of right coronary ligament, and this is the anterior rim of left coronary ligament. And if you just see here, this is the right lateral surface, and this is the posterior surface. This is the posterior surface of the liver. Now, as I said, that this is the right coronary ligament, this is the left coronary ligament, and this is the anterior rim of right coronary ligament, and this is the posterior rim of right coronary ligament, and this is the posterior rim of left coronary ligament, and this is the anterior rim of left coronary ligament. If you see between the anterior rim of right coronary ligament and posterior coronary and the posterior rim of coronary ligament, there is a space, there is an area, this area which is on the posterior surface, and this area is called bare area. The two rims of right coronary ligament, that is the anterior rim of right coronary ligament and posterior rim of coronary ligament, they continue as right triangular ligament. So this is the right triangular ligament. Similarly, the posterior rim of right coronary ligament and anterior rim of right coronary ligament, left coronary ligament continue as left triangular ligament. So these are the ligaments of the liver, by which liver remains anchored and attached with the diaphragm, and the posterior surface of anterior abdominal wall.
So that was all about the ligaments of the liver. Now let me put a final word here about the ductus venosus. The ligamentum venosus is the remnant of ductus venosus, which in the fetal life connects the umbilical vein with the inferior vena cava. The liver has dual blood supply from the portal vein and hepatic artery. The portal vein receives the blood of spleen, pancreas and intestines, and it supplies 75% of the blood to the liver. It is rich in nutrients but poor in oxygen. The hepatic artery is a branch of celiac trunk of aorta, supplies 25% of the blood to the liver. It is oxygen rich and nutrient poor. The blood supply from the hepatic artery and portal vein is drained into central veins. The liver has got exocrine function, which is carried out by the bile, and bile goes to the intestines for the digestion of the fat and other parts of the food. Now coming to Coinard's classification of liver anatomy. This is important as far as surgery of the liver is concerned. So in Coinard's classification of liver anatomy, the liver is divided into 8 functionally independent segments, and each segment has its own vascular inflow, outflow and biliary drainage. Now if you see here, these are the 8 segments. The liver is divided into 8 segments, and each segment is functionally independent, having its own vascular inflow, that is from the portal vein and branches of the hepatic artery, and outflow is from the hepatic vein. So this is the outflow, these are the hepatic veins, and also the biliary drainage is there in each segment. Now, as I said that the liver is divided into 8 segments, and these segments are lateral superior segment, lateral inferior segment. So this is the left lobe. The left lobe is divided into lateral superior and lateral inferior, and is divided into medial superior and inferior. So this is the segment 4, which is divided into 4A and 4B. That means medial superior and medial inferior. Then we got anterior superior and anterior inferior, that is segment 8 and segment 5. And then we got a segment 6 and 7 as posterior superior and posterior inferior. So if I count, this is 1, 2, 3, 4, 5, 6, 7, and the first segment is the caudate lobe. Now you can see here how the liver is divided into the segments. This is the inferior vena cava, this is the middle hepatic vein, and this is the left hepatic vein, this is the right hepatic vein. And horizontally it is divided by the portal vein into superior compartment and inferior compartment. So it is the hepatic veins which divide the liver into 8 segments. This is the left hepatic vein, this is the right hepatic vein, and this is the middle hepatic vein. And these veins, they drain into inferior vena cava. So the outflow drainage from the liver is through these hepatic veins that drain into the inferior vena cava, and inflow is through the portal veins, which divides into left and right branches, which run horizontally in the liver in the center and divided into upper compartment and lower compartment. So I can show it again. So the middle hepatic vein divides first liver into right and left lobes, and this plane runs from the inferior vena cava to the gallbladder fossa. So this middle hepatic vein, the plane of it runs from the inferior vena cava to the gallbladder. So this is inferior vena cava, this is the gallbladder fossa. So it runs in this plane, dividing the liver into left lobe and the right lobe. And then the right middle hepatic vein divides this right lobe into the 3 compartments. This is the compartment 4, which is subdivided into 4A, 4B, and this is second and this is third. And then the right hepatic vein divides the right lobe into the anterior compartment. This is anterior compartment, this is posterior compartment. The left hepatic vein is here, which is along the falciparum ligament, and the portal vein, as I said, the portal vein which runs horizontally right and left branch divides into upper and lower segments. Let me show it again. So you can see how the orientation of different segments are in the liver. The 8 independent segments, each of which has its own vascular inflow, outflow and biliary drainage. Because of this division into self-contained units, each segment can be resected without damaging the other segment. So the importance of these segments is that any of these segments can be resected without damaging the other segments. So you can see the orientation of the segments in the liver. For liver to remain viable, resection must proceed along the vessels that define the peripheries of these segments. In general, this means resection lines parallel the hepatic veins while preserving the portal vein, bile duct and hepatic arteries that provide vascular inflow and biliary drainage through the center of the segments. Coenards divided the liver into functional left and right liver, as I said, by the main middle hepatic artery, which is a branch of inferior vena cava, and this middle hepatic vein, which runs along the plane of inferior vena cava and gallbladder fossa, is called Cantley's line. The Cantley's line runs from the middle of the gallbladder fossa anteriorly to the inferior vena cava posteriorly.